All right, welcome back to ABA exam review and our latest BCBA exam practice question set. We're going to go through this set together and break them down. If you're new to the channel, welcome. If you're returning, welcome back. Please like and subscribe. Check out behavioranalyststudy.com for all of our study materials, including our combo pack. As always, when you pass, please let us know so we can include you in the Sunday shout out. Work hard, study hard. Let's get going. The county fair is in town, and Henry takes his daughter on Friday night. They play some carnival games, and his daughter wins a very loud whistle. She insists on blowing the whistle constantly on her way home, in her room, and at the dinner table. So when she goes to brush her teeth, Henry removes the noisemaker from the whistle. Henry is attempting what? All right. We're attacking the question, but based on the answer choices, it's clearly an extinction question. With that said, we've got to understand what the question is asking and what is Henry actually attempting. We know he took his daughter to the fair on Friday night. They played games. She won a loud whistle. She blew the whistle on her way home, in her room, and at the dinner table. So she's engaging in this behavior all over the place in all different situations. Immediately, you should be thinking some sort of automatic or sensory reinforcement, right? Or function, I should say, because it's happening everywhere. She's not really trying to obtain a tangible. There's no tangible in play. Doesn't look like she's trying to gain attention. It doesn't mention anything about getting Henry's attention, and it's happening all over these places. And it doesn't say anything about her trying to escape from anything. Additionally, Henry removes the noisemaker from the whistle, meaning she can try to blow the whistle all she wants, but there's no noise that's going to be coming out. So what is Henry attempting? Well, in terms of extinction, it's most likely going to be C, sensory extinction. We implement extinction typically based on the function because the function typically tells us what's maintaining the behavior. She's not looking for tangibles. She's not looking to escape. She doesn't seem to want attention. None of those things are really mentioned. All we know is she's blowing this whistle everywhere. And to put an extinction, Henry's removed the noisemaker altogether. So Henry is attempting what? C, sensory extinction. A 4-year-old boy with emerging language skills will engage in frequent occurrences of tongue clicking and babbling. It is difficult to determine when the tongue clicking starts and when it ends, but you want to measure it anyway and potentially design a plan for the behaviors. Which of the following measurement systems would be the most sensitive to changes in tongue clicking and babbling? When we talk about sensitive measurement systems, we mean measurement systems who are going to capture all the changes, little and big, in behavior. The more continuous your measurement, the more sensitive it's going to be. The issue we have with discontinuous measurement is it only captures a sample of behavior. So if behavior starts to change at night and we're recording in the morning, we're not going to really capture that. So when talking sensitivity of measurement, you're always looking for a more continuous measurement system. So if we look at our answer choices, partial interval and momentary time sampling just aren't going to be as sensitive as frequency and duration. So now it comes down to what makes more sense here. We've got a 4-year-old boy engaging in tongue clicking and babbling. It's difficult to determine when it starts and when it ends. Frequency measures what? It measures a discrete response. To have a discrete response, we need a clear beginning and a clear end. Now, you could argue duration, you need a clear beginning and end as well, which is helpful, but clear beginning and end is much more important for frequency, which is actually measuring discrete responses. At least with duration, you can get a good sense of how long these things last. Okay. With frequency, with no clear beginning and end, your count could be all over the place. So frequency and duration are going to be more sensitive than the discontinuous measurements. But since we don't have a clear beginning and end, and we don't have a better option, our best option here is going to be B, duration. You want to implement a differential reinforcement strategy in the client's home to increase manning appropriately for items they want or need. You're concerned that the behavior contrast could be a problem at the client's school. What are some steps you can take to manage behavior contrast? What is behavior contrast? It's when a behavior changes in one setting and it changes in the opposite direction in another. Typically occurs because you change the schedule or the intervention in one setting and not in the other. Commonly, if a behavior starts to receive reinforcement in one setting and not in the other, it's going to start happening more in the reinforcement setting. So in this case, you're implementing this differential reinforcement strategy, but you think behavior contrast might happen at school. What should you do to manage that? A, train the school on the DR strategy. Well, that's the best way. Just implement the strategy everywhere. That's the best way to control for contrast, being consistent. What about B, take data on manning at school to observe whether behavior contrast is occurring? Well, sure. The only way to truly know if it's occurring is with data. We shouldn't use indirect anecdotal data to make these determinations. So, training them on DR, very smart. Taking data on the behavior at school as well, also very smart. What about C? Implement the differential reinforcement procedure, but only use extinction at home. Not a good idea. Why? Extinction needs to be used as close to 100% of the time as possible. If we're only using it in one place, not a good idea. If we want to manage behavior contrast, we need to A, train the school on the DR strategy, and B, take data on manning at school to observe whether behavior contrast is occurring. So the answer here is going to be D, both A and B. You're designing a social skills training program that you plan to teach to several behavior technicians from all over your city. Your goal is for the technicians to be able to leave the training and start implementing the social skills program immediately. To achieve this goal, which of the following is the most important dimension to adhere to in your social skills program? Long question, dimension question. Dimension questions, we need to be very specific about what the question is asking. We're asking about, we need to adhere to this goal, right, of technicians being able to leave training and implement the program immediately. So we want them to be able to go from the training to implementing the program. In other words, we need to replicate it. So what dimension? A, conceptually systematic. Even if you weren't conceptually systematic, they could still go and replicate it, right? As long as it's B, technological. Technological deals with replication. C, applied. Applied is obviously important. We target valid and socially meaning things. But even if we didn't, if they could go implement it, it's technological. Same with behavioral. Okay. We need to be able to measure it behaviorally, observe it. Even if we can't, though, as long as it's technological, they can go from training to implementation right away. That's the whole idea with technological. So to achieve this goal, which of the following is the most important dimension? It's going to be B, technological. Megan and Mike are exploring the mountains in Utah. Mike spots a cave and says to Megan, I think it's safe. Mike's verbal behavior could be described as a what? All right, autoclitics. Autoclitics are kind of strange. Typically, we think of autoclitics as explaining or describing one's own verbal behavior, which seems confusing, right? With autoclitics, we kind of have a primary verbal operant, secondary. Just think of an autoclitic as an addition to maybe your verbal operant, right? In this case, Mike spots a cave and says, I think it's safe. So what is he? He's tacting. He's saying safety, okay? The I think is describing his own verbal behavior. Therefore, Mike's verbal behavior is an autoclitic tack. It's not an interverbal because Mike isn't responding to a verbal ST. It's not a man. He's not responding to an MO. He's not requesting anything. And it's not an echoic because he's not copying a verbal stimulus. He's tacting. He's describing his tact. It's B, an autoclitic tact. Don't overcomplicate autoclitics. They're a little strange, all right? Typically, they're just describing our own verbal behavior. A case transfer occurs after a behavior analyst leaves the company. The new behavior analyst is giving 3 new cases. All 3 cases have been with the company for over a year, and the clients are making progress. What should the new behavior analyst make sure and do? Okay, ethical question. You get cases, new cases, maybe cases that just started, cases that have been going on for a long time, and you want to make sure that they continue making progress, obviously. But you're in a situation where you're coming in and you've got all these already written treatment plans. But what do we know about treatment plans? We don't plagiarize treatment plans, so we can't go in and just start claiming theirs as our own. Also, sure, maybe they're making progress. They've been with the company a long time. What do we know about that progress? What do we know about the data? What do we know about anything? Nothing yet. So what do we have to do first? B, avoid making any major changes to the treatment plan. Well, no, you're in charge now. You need to go in with a fine-tooth comb and make sure everything is solid, Okay. Even if it appears they're making progress with the data, you need to go and double check that. B, avoid making any changes to the treatment plan at all. So A is saying major changes. B say make any changes. Okay. Well, we're not going to avoid making changes, right? We're going to go in and put our own glasses on it, right? Our own magnifying glass on it and see what is going on. It's always good to have a second set of eyes. What you need to do is C, conduct a functional behavior assessment whenever she officially begins the case. Whenever you get your own client or a new client or a transfer, no matter what, new client, starting a client that's new to you, always have to do your own assessment. And then D, change the treatment plan to fit her own assessment, but do not modify the behavior plan. Again, all modifications, all changes are going to be contingent on your own assessment, which you need to be sure and do. So what does the new behavior analyst need to have to do? She needs to conduct a functional behavior assessment whenever she officially begins the case. A system where 3 siblings would be given an hour of Xbox time before bed and another 15 minutes that could be taken away contingent on behavior would be considered what? All right. You might have seen a question like this before on our stuff. We're just reviewing response cost. Response cost. Okay. Response cost is when you remove a previously gained reinforcer or an already present reinforcer contingent on behavior. In this case, siblings get an hour of Xbox before bed. They get another 15 minutes. That is the response cost. So when you've got this extra built in as the response cost procedure, what do we call that? Extra interval bonus remediated. So it's called a bonus response cost. But if you're not fluent, extra sounds pretty good. Maybe interval sounds good. That's why fluency is so important, because you can have terms that sound very similar, and one term has absolutely no meaning at all. Extra response cost is nothing. This is called a bonus response cost. So this really highlights how important fluency is and the familiarity with your terms and definitions. So given another 15 minutes that can be taken away contingent on behavior would be considered C, a bonus response cost. You ask your technician to take momentary time sampling data on the client's task engagement behavior. Intervals are set at 20 seconds, and the technician must take 5 minutes of data. The first 3 intervals, the client is engaged with the task for 15 seconds, 5 seconds, and 12 seconds. How many responses should your technician record? So let's think about this. And responses, right, in partial interval, whole interval, and momentary time sampling, when a response is recorded? Well, they're recorded once per interval if they happen. Momentary time sampling is contingent on the behavior happening at the end of the interval. So intervals are set at 20 seconds in this case. Does the behavior happen at the end of the interval? Does it not? That's what we're asking ourselves. All we know is the client engaged for 15 seconds, 5 seconds, 12 seconds. Now, if the client engaged for 15 seconds at the end of the interval, that's one thing. If it's at the beginning, it's a whole other thing. We need to know, when did the behavior occur? Did it occur at the end of the interval? Yes or no? Since we don't know that, we can't answer how many responses should your technician record. So our answer really is going to be cannot determine. To take momentary time sampling, I have to know when the behavior occurs. Specifically, did it occur at the end of the interval? Yes or no? I don't know that. I cannot determine how many responses my technician should record. Great. Make sure you check out behavioranalyststudy.com for all of our study materials. Please subscribe. Work hard, study hard. Let us know when you pass. See you soon.